Evening. My name is Candace and I'm an event manager. On behalf of the staff at Town Hall Seattle and our friends at Third Place Books, it's my pleasure to welcome you to our presentation tonight with Dr. MeiLan K and Dr. Albert Rizzo. As we get underway, I would like to acknowledge that our institution stands on the unceded traditional territory of the Coast Salish people, particularly the Duwamish. We thank them for our continued use of the natural resources of their ancestral homeland. We're so glad you've joined us tonight. The presentation will run for about an hour, including Q&A. To submit your questions for the Q&A portion of the event, please enter meet.ps/Han or scan the QR code right now that's on your screen with your smartphone. We'll drop this link in the chat as well and remind folks where to go once we get to the Q&A. We can't guarantee that we'll get to every question, but we'll try to get to as many as we can, and you can help us by keeping your questions concise. For those who would like to view the program with closed captions, you can click the CC button in the bottom right corner of the video player. Town Hall is adding new programs and podcasts every day. Upcoming events include Neil Stevenson discussing his newest thriller, Termination Shock, and David DeSteno with Lisa Feldman Barrett discussing how religion can help the mind and body regardless of faith. Visit our website to join our email list and get the latest updates as more programs are added throughout the season. Town Hall's work is made possible through your support and the support of our sponsors. As part of our Arno G. Matolsky Science Series, this event is supported by Microsoft. Town Hall is also a member-supported organization, so I want to thank all of the members watching tonight. If you share in Town Hall's goal of a community energized and empowered by considering questions of civics, science, and culture, please consider supporting us by becoming a member. You can find more membership information on our website. And lastly, you'll want to dive deeper into tonight's topic by purchasing your own copy of the book. Please use the link in the chat below to pick up your copy through Third Place Books. And now for tonight's program. MeiLan K is a professor of medicine in the Division of Pulmonary and Critical Care at the University of Michigan. She also serves on the scientific advisory committees for both the COPD Foundation and the American Lung Association, where she also serves as a spokesperson. She is currently an associate editor for the American Journal of Respiratory and Critical Care Medicine and serves on the editorial boards for Thorax, Lancet Respiratory Medicine, and Journal of the COPD Foundation. Albert A. Rizzo is Chief Medical Officer for the American Lung Association and is a member of the Christiana Care Pulmonary Associates in Newark, Delaware. He has been featured in national news outlets including CNN, The New York Times, ABC News, The Today Show, and many more. He serves as the host of the Lung Association's LungCast podcast. Han's new book, Breathing Lessons, A Doctor's Guide to Lung Health, is the subject of this evening's talk. Please join me in welcoming Dr. MeiLan K. and Dr. Albert Rizzo.
Thanks so much, Candace.
Thank you, Candace. So MeiLan, it's a real pleasure to be able to speak to you tonight, especially around the release of your new book, Breathing Lessons. And also, as been mentioned, you've been an important part of the American Lung Association family for the last several years. We'll get into more specifics of that later on, but I thought it would be a good idea to set the stage by having you tell us how you ended up in the field of pulmonary medicine, particularly as a clinician, researcher, and academician at the University of Michigan.
Well, thanks, Al. So I actually have, for our viewers out there, my roots are actually in the Northwest. So I grew up in Idaho Falls, if anyone has heard of it. But I did my undergraduate and medical school at the University of Washington in Seattle. I was actually, for those of you who are familiar with the program, I was a WAMI, which means that because some of the other states, including Idaho, don't have medical schools, I split some of my time between the Idaho campus and the Seattle campus for med school. So I was really, what University of Washington really excels at is helping to produce and create primary care doctors for the Northwest, because it's not a very populous part of the country and primary care is so important there. And I really thought that I was going to go back and serve in a rural area where there's huge needs for doctors who can essentially just do everything. But, there's this sort of mantra that you should go away to come back. And so I thought, okay, well, I'll go away for residency, and then I will come back to Seattle. But I came to the University of Michigan in Ann Arbor for residency. And I think, like many young doctors, was really fascinated by a lot of the physiology that was going on in the ICU, and just felt like a lot of the doctors that I worked with in pulmonary were just great people and great doctors. And I wanted to be like that. So I stayed on for fellowship there, met my husband, and then I never left. uh, you know, I, you- I found a niche here where I felt like I could still do some good and contribute to society and help people and help patients by kind of, continuing I do a lot of research and patient care now. So it wasn't exactly where I started or where I thought I would end up, but with the, launch of the book, and I'll just kind of show it to everybody here, with getting to do stuff like that and working with the American Lung Association, it's actually been, kind of really, for me, really rewarding.
It's great. And the Lung Association is truly great that you have been working with us. In fact, your academic career is probably the main reason you come to be associated with us. And we have you wear a couple hats at the Lung Association, two very important ones. One is you're one of the principal investigators at Michigan for our Airways Clinical Research Centers. It's a network of the largest not-for-profit clinical research centers dedicated to asthma and chronic obstructive lung disease. And you're also a medical spokesperson for the organization. And from time to time, we have to call on you to comment on issues in the news related to lung health. A lot of this sounds like you're a very busy person, clinically, research, and administrative, but tell us about how you balance that and why it's important that you do all those things you do the way you do.
Yeah, well, thanks for asking me. I think that's one of sort of the joys of being in academic medicine. Don't tell anyone, but we kind of get to within certain boundaries, kind of get to focus on things, passion projects and things that are important to us. And I actually have an interest in women's lung health. And we hear a lot about women's heart health, but we don't hear as much about women's lung health. I actually run a women's respiratory clinic, and there's actually a very rare lung disease that only affects women, as you know, lymphangioliomyomatosis, longest word I learned in medical school, that I actually focus on and care for. And one of my first interactions with the American Lung Association was they had done a series of campaigns, Catch Your Breath, focusing on the importance of women's lung health and raising profiles for women's lung health. I've actually had the opportunity to even testify at Congress, talking about issues and importance of funding around that. So that was really sort of my first entree into working with the American Lung Association. And then when they developed the national spokesperson program, they called on me again, and I was, I kind of jumped at the opportunity. But as you mentioned, I've also had the chance to work with the American Lung Association on research projects as well. One of the things that I talk about in the book is that we do have kind of a lack of funding for lung health and a lack of awareness for lung disease that's pretty pervasive. And that's part of the reason why I wrote the book. And that's why I think it's really amazing that the American Lung Association does have its own clinical research network to do studies that are, really, really important. One of the things that I talk about in the book is the evolution of kind of why we are where we are today, with respect to what we understand about lung disease. And I think what I did in the book is I did some research to try to understand, for instance, why do we talk about heart health and why do we never talk about lung health? And one of the things that I realized in researching for the book is it's really fascinating that the spirometer, which measures how our lungs function, was actually invented well before the blood pressure cuff. But clinicians in the early part of the 1900s thought that doing blood pressure measurements were really cool. that it made them look smart, and patients would think, oh, wow, you're amazing. So it really took off. Physicians loved taking blood pressure. They loved having the stethoscope. But spirometry just wasn't viewed as being nearly as cool. And then unfortunately, fortunately or unfortunately, over time, we've blood pressure measurements have become ubiquitous, but we've learned that it's important, that hypertension is important, and that we can do things to prevent cardiovascular disease. But at the same time, measuring lung health and lung measurements never took off. And so now we struggle because physicians, a lot of physicians don't have them in their office. Some physicians aren't even comfortable with performing the tests. And then it's led to sort of this gross under recognition of lung disease. And so here we are in the middle of, hopefully towards the end of, a massive respiratory pandemic, where, we suddenly realize that understanding how the lungs are injured and understanding how they repair, just this basic knowledge is so important. And that it's got to be a priority for everyone to understand how their lungs work, how to protect their lungs. And so it was really the opportunity that I had as being a spokesperson with the American Lung Association, and actually having a chance to talk on NPR about, at the very beginning of the pandemic, about what is a mechanical ventilator and how does it work, that actually led to me ultimately writing the book. So I think in that way, I definitely have the American Lung Association to thank for the opportunity to get to write it.
No, I think you're absolutely right about the lung always taking a back seat to some other conditions, especially the heart. I remember certain campaigns about know your numbers. I mean, many people know their cholesterol. Many people know their hemoglobin A1C if they're diabetic. Not too many people know what their FEV1 is or what it even means. So I think raising awareness about lung health, really, we can't do more. And I think your book goes a long way to doing that. And you also mentioned the pandemic. And for a lot of reasons, the respiratory health has been in the front lines for reasons like climate change, air quality, cigarette smoking, vaping. All those things have been around for quite a while, impact our respiratory health. But now we have a new respiratory infection. We used to be the Lung Association that fought tuberculosis and got that under control, at least in this country. We still deal with influenza and respiratory syncytial virus, but SARS-CoV-2 has inflicted illness and death on hundreds of thousands of individuals. And I believe you, as a pulmonary critical care physician, as I am as well, we've unfortunately had to be on the front lines the last couple of years dealing with this. So why don't you give a little bit of a background about what has happened with our practices and how we handle the pandemic in our ICUs and hospitals?
Yeah, the pandemic has really rocked our worlds, so to speak. I mean, it's obviously impacted everyone, but perhaps no one in the healthcare field as much as pulmonary and critical care doctors. It's really impacted every aspect of our lives. We are we're at Michigan in the middle of our fourth surge. And I am the incoming division chief for pulmonary and critical care there. And so we are dealing with massive staffing issues. We don't have enough physicians. We don't have enough PAs and nurse practitioners. We don't have enough nurses. We don't have enough MAs. So everyone is really, really burnt out. I suppose the good news is that we understand how better to care for COVID now than we did at the beginning. At the beginning, I think a lot of us were scared. We were scared for ourselves. We didn't exactly know how the virus was transmitted, or in many cases, our hospitals may not have had the adequate protective equipment to give us to protect us. We were scared about transmitting it to our families. Much of our work either got shut down. I'm in the respiratory field, so a lot of my research got just shut down. We quit doing breathing tests, or that we didn't have enough ways to test people coming into the hospital to try to figure out if they were safe or not to run some of our routine tests on. We just had so much to figure out. We were inventing local PCR-based tests on a hospital by hospital basis just to try to deal with this. And then add to that, most pulmonary and critical care doctors, as you know, do both. We do pulmonary and critical care. So that means we're trying to take care of outpatients and inpatients at the same time. So much of our care moved to virtual, which is okay for some patient populations. But for other patient populations that are older, live in more remote areas, don't have internet, don't have smart anything, trying to figure out how to deliver virtual care to those patients was really, really challenging. So I wish that I could say we have it, 2 years in now, that we have it all figured out. Some of it's definitely better. I think most of our patients have figured out how to access care now, but staffing has not gotten better. How we handle, like I said, we're in the middle of a surge right now here in Michigan. We're still, from a healthcare perspective, we're still really struggling.
While we're on COVID, this might be a good time to answer a question that's come through. We want to know exactly, we talk about a respiratory pathogen, that SARS-CoV-2. What does the virus actually do in our lungs that leads to the critical illnesses?
So I don't actually have that many illustrations in the book, but I don't know if I can show this on Zoom or not. I will point you to, there is a very cool figure in the book, which I'm probably not going to, this is going to be messed up, me trying to show this. All right. I don't know if I can do this or not. You can maybe you can kind of see it, but it is a picture of the SARS-CoV-2 virus literally coating the lung cells. You can see them individually, one by one. So what happens, I want to back up for a moment, because there is something profound that happened with our understanding of how respiratory viruses that spread during the pandemic that I'm not sure everyone picked up on. And at the beginning of the pandemic, we thought that most respiratory viruses like SARS-CoV-2 were transmitted mostly via droplets. These are larger particles that fall quickly to the ground. And that is why almost all of the public health guidance was on social distancing and hand washing, things like that. What we found during the pandemic is that SARS-CoV-2 is also largely spread by aerosols. These are much, much smaller particles that hang in the air much, much longer. And that's where protective measures like masks and ventilation become so important. And we didn't really quite realize that. So the virus, you breathe it in, it hits your nasal passages. And then once everyone hears about the spike protein. Well, that spike protein grabs onto cells and does sort of a special handshake with the cell. There's a receptor there, the ACE receptor that it recognizes. The body says, oh, okay, we recognize this. It sucks it in. It's like a Trojan horse. It brings that virus in. Once the virus gets into the cell, it takes over, reprograms, provides its own RNA and says, you know what, instead of doing all your normal cellular functions, you're now ours. And all the cell does now is kick out new virus, spits out the virus. The virus starts spreading down the respiratory chain. And then the lining of your respiratory tract is now just a virus producing engine. Initially, you may not notice much, but the more virus that accumulates, the more cells die. The more white blood cells are recruited to fight the infection. And then you start getting collateral damage. You start getting respiratory cells that are dying. They can't do the functions that they normally do, which is exchange gas for us. Fluid builds up, debris builds up. Lungs now can't get oxygen in like they used to be able to. The cells can't regenerate the way that they're supposed to. And in some cases, that's what ultimately leads to respiratory failure and lands people in the hospital. The degree to which the virus causes damage is directly proportional to how sick people get. So it's really fascinating. I encourage you to check out the picture in the book. It's really, really, well, cool and kind of a fascinating, maybe, a little bit scary kind of way that you can literally just see how the virus coats the inner linings of the lung.
Yeah, you give a good description about the acute illness and how some people end up in the intensive care unit and unfortunately don't make it out. But we're also, as the Lung Association, very concerned about people who are now having damaged lungs. They survive, but now they're becoming chronically ill from either scarring or a fibrotic process that has left them crippled. So again, it's going to be a whole new population of chronic lung disease, and we still don't know the answers to that as well, right? We don't know what's exactly going on and how to treat these individuals long term.
Yeah, we're really, really trying to grapple with that. And what we're finding is just a whole host of various abnormalities, although in some cases we can't figure out what's wrong. So for some patients, it's that they've got scarring in the lungs. These maybe the patients that were in the ICU or on the ventilator. Other patients, I have patients that got blood clots in the pulmonary arteries in the lungs, and they've got persistent issues related to that. Some patients may have had heart damage. And then in other patients, they just persist with not feeling well, with chronic fatigue. And for some of these patients, we're really struggling to try to understand, what is wrong, because some of our more objective measures like breathing tests or CAT scans aren't showing up anything. And so we, as a healthcare, group, we completely acknowledge that these patients are not feeling well and suffering, but we are still kind of struggling. So the NIH has, as well as the American Lung Association, is investing a lot of money into try to identify people that know they were sick, didn't know they were sick, comparing blood samples, comparing lung scans, breathing tests, et cetera, to see what we can do to try to understand why some patients are having these really prolonged recovery times and what we can do to try to help them. But I think, as you point out, it is going to be perhaps a new generation of patients with a chronic illness.
So let's shift gears a little bit and get away from COVID. As I mentioned before, as lung physicians, pulmonary physicians, we've been dealing with things like climate change and how it affects air quality and tobacco and nicotine and vaping, which actually would potentially bring a whole new generation of people who are addicted to tobacco products because of the vaping. Your research deals a lot around airways disease, as is our network. Can you talk a little bit more about those other non-COVID lung problems that we've been dealing with for a while? I know you bring them up in your book, the different disease states.
Well, one of the things that I want our listeners tonight to know is that we are beginning to understand that what happens to your lungs in the womb and what happens to your lungs as a child and adolescent and early adult may be just as important as what happens in adulthood. As pulmonologists, we very much focused on, don't smoke, which is still incredibly important, but we've kind of not really addressed the whole thing. And what we're realizing is that there are a lot of people in adulthood that probably have some predisposition to lung disease that started well before adulthood. And so one of the messages that I want to get out with the book is that we have to start thinking about protecting ourselves as well as our children over the lifespan. You don't start worrying about things, only once you are 40, 50, et cetera. You've got to start thinking literally almost at the point of conception. So we know, for instance, that nicotine exposure in the womb can lead to the development of really long and tortuous airways that can predispose people to things like asthma and COPD, which means that pregnant women, for instance, shouldn't be lulled into some false sense of security that electronic cigarettes, for instance, are better. We know that there's just as many carcinogens, if not more, and harmful chemicals in vaping liquid, particularly once it's been burned, as there are in conventional cigarettes. So we have to think about that. And then as children are born and kind of proceed throughout life, we have to figure out ways to protect them. So one of the best things that we can do is, before COVID, it was vaccinations for most, standard respiratory viruses. Now, post-COVID, my son's 8, he got his COVID vaccine today. So that's part of the additional arsenal to protect him. But, there's all sorts of other threats to lung health as our kids get older. So one of them that the American Lung Association has been really fighting is air pollution. So there are, I know this is in Seattle, this is in the West. So when air pollution and climate change is becoming a real increasing threat to lung health. We were actually chatting before the show started about the fact there was a really interesting study that just came out of Oregon that showed that people that were exposed to pollution from wildfires this last year actually had, there were increased rates of COVID infections in those areas. And they think it's probably because the pollution inflamed the lungs more. And so they were more susceptible to damage from COVID. So it's all interrelated. But in the book, you can't control wildfires, and sometimes you can't control where you live, but there are some simple things that we can do, besides, attacking things at a policy level, things like paying attention to air quality, maybe not doing heavy outdoor stuff on poor air quality days. The American Lung Association, for instance, has a really great spot on the website about things like anti-idling policies at school, trying to reduce emissions from cars, just, in the parking lots near playgrounds at schools. There's, again, just some really simple things. And then, before the COVID pandemic, we were dealing with E-Valley. So the vaping lung injury. And, I think if there are people out there who are parents or grandparents or have siblings that are still, middle-aged to high school, I think one kind of a key takeaway is that, the time to start talking to middle schoolers, time to start talking to young kids really is sort of the middle school age range. That's where kids are starting to be exposed. We have a huge proportion of our young people that have been exposed or trying vaping products around that age. And unfortunately, as you know, Al, the FDA has been really, really slow to act on this. And we've had, unfortunately, the market flooded with flavored products, for instance, that really appeal to youth. So these are all things that potentially could happen to someone before they ever reach adulthood. So we really have to think about protecting the lungs, and then preserve, once you hit that peak lung function, which actually, by the way, for people who may not know this, it's around 25. So, that's why things like tobacco 21 laws in my mind make so much sense. You've got to protect growing bodies. While we may recognize 18 as the age of adulthood, some parts of the body are still growing until a little bit later. So, and then, as we, I think, progress in adulthood, again, some of the same threats are there, but then there's new ones, workplace threats. Again, depending on the job, some jobs, for instance, that you don't typically think about are really exposed to a lot of harmful compounds, like hairdressers and things like that. So I think, one message that I would have for people who are watching or listening is just to be cognizant of what you're breathing in, cognizant of your environment. If, we protect our hands when we, wash dishes or we garden, but a lot of times we forget there might be household activities where, it would be a really good idea to wear a mask, or, I would put on a coat when it's cold. Maybe I should think about the air quality that day, and, whether this is maybe the best day to be doing the huge outside project, et cetera. So I think part of it is just being conscious.
Absolutely. And while you were talking about some of the tobacco issues, one of the questions that came in said they had recently been in Europe, and especially in Italy, and was so amazed as to how many people still smoked, and wanted to know how the campaign in this country has been so successful in getting the smoking rates down. And I think in large part it goes to organizations like the Lung Association and researchers like yourself. But I think you mentioned that it's education, advocacy, research that we're doing, all those things working together as a coalition help make that happen. I don't know if you have other thoughts on that or not, MeiLan.
I think it's probably complicated. Some of it's cultural. I remember it's been a while. I have to admit, I haven't traveled much during the pandemic, but I've always been shocked at the very, very high rates of cigarette use in Asia. So we do see really big swings and variation in tobacco use. Certain countries, there's a much more stigma for women, for instance. So in Asian countries, you're going to see a lot fewer women who at least smoke conventional cigarettes. So it is an interesting question. And I admit I don't fully have the answers but it probably also has some to do with aggressiveness for tobacco marketing, which some countries have pushed back and said, no, you can't market this way and you can't do this and you've got to have labels. And I would say, well, I would like the FDA to do more. At least the US does have some regulations where in other countries, the tobacco lobby has been really, really successful in kind of squashing that. So I think that's, that's certainly part of it. Pricing, culture, all make a difference. But as you point out, Al, I think that's why some of the efforts on the part of the American Lung Association are so important. People may not know that the American Lung Association actually sued the FDA for their lack of oversight and regulation, particularly for electronic cigarettes, and in particular, looking at some of these flavored products in youth. So I'm glad we're not the worst, but I think there's still work to be done.
It can be better, right? Sticking with the topic of lung health and preventing lung disease, for a number of years we've been promoting vaccinations for influenza, pneumonia, pertussis, and now unfortunately the vaccine for COVID has been certainly in the news for the last year or two because of hesitancy. But can you talk about the importance of vaccinations for all these other respiratory pathogens, especially in the population of people we deal with who may have chronic lung disease?
Yeah. So, what's fascinating is that during the pandemic, when everyone was home or wearing masks, we saw a huge drop in patients having flare-ups of breathing trouble. And it made me realize just what a large percentage of periodic breathing trouble, particularly for patients with chronic lung conditions, is actually attributable to viruses because they simply aren't getting exposed. The other thing that I think is really interesting, and this is an active area of research, and we're still trying to understand this, but there is research to suggest that once you get a viral infection, it actually there's inflammation, there's all sorts of things that change within the lung, the pH, nutrients available, everything that's shifted when you have a new pathogen in the ecosystem. And what we've seen is that, particularly for patients with chronic lung disease, a virus can enter the ecosystem and change it so much that bacteria that perhaps wouldn't normally flourish. And so you can get a virus is the start, and then a bacterial infection is sort of the second phase. And we had known that could happen with influenza. But there's, I think, increasing research that I've seen that even things like a more common respiratory virus that maybe people have or haven't heard of called rhinovirus, it can happen with that as well. So I think that it's a very complicated relationship, but I think we are learning that the whole host of respiratory pathogens are responsible for a lot of the kind of common symptoms and flare-ups that a lot of our patients have on a frequent basis.
You mentioned earlier the peak lung health and worrying about your lungs from the embryo on. Could you tell us a little bit about the American Lung Association Lung Health Cohort study that's just getting underway that you're part of as part of our network, and what the important role that's going to play in lung disease and lung health?
It's really interesting, kind of going back historically. So one of the things that the last chapter of the book, it's called the fifth vital sign. And my point there is that when we look at sort of when you go into the doctor's office, and they get the, respiratory rate, heart rate, temperature, and blood pressure. I argue that a breathing test should be the fifth vital sign. We don't get it. But part of the evidence basis for why blood pressure is so important has to do with a really large observational study that was done in Framingham, Massachusetts, and it's called the Framingham study. And that study enrolled a ton of people, followed them over time, and really generated a huge amount of evidence for us to suggest why measuring blood pressure is important, why treating blood pressure is important, why treating cholesterol is important, exercise, lots of things that we now completely accept as being important because this big, massive study was done. We have never had a similar study for lung before. And so fortunately, right before the pandemic, the American Lung Association teamed up with the National Institutes of Health, the lung branch, and kicked off a new study of young people. So previously, most of the large studies that we have looked at people who have lung disease. But if we want to figure out how to cure lung disease and prevent it, we have to look at people before it's clear that it's actually started. In particular, people that are just never getting these measurements done on a routine basis, because we just don't do that. And so that's what to me is so exciting about this new lung health cohort study, which, by the way, is enrolling in Seattle. There is a Dr. David Au is the principal investigator in Seattle. So if there's anyone listening that's interested, it should be enrolling soon. Actually, we were a little bit delayed. But what's so cool about this study is that it's enrolling young adults aged 25 to 35. And we'll be collecting all sorts of information that we don't normally collect. So not just breathing tests, we're also going to be getting CAT scans on patients. That's actually a huge research focus of mine, but trying to just figure out, are there subtle signs of injury to the lung at a really early age? Can we relate those to exposures like air pollution, to behaviors, to genetics, et cetera? So I think that the most exciting things about this study are probably yet to come as we start to follow patients over time and investigate certain pieces of this. But perhaps what's most exciting to me is that we're finally going to get a study like this. It's taken so long to get the funding in place for something of this magnitude. So, if you're listening, there is a site in Seattle. I encourage you to think about it. But yeah, I'm just super excited to see that the American Lung Association and the NIH will be sponsoring something like this, because, the issue is that we're kind of just caught in this vicious cycle where we don't pick up patients until they're really sick. And then if we want to study treatments, we only have really sick patients to study them in, and it can be harder to show benefit when people are really sick. And so then we don't have the evidence basis that people need to say, oh, well, we should be screening patients earlier. And so we just can't seem to break this cycle. And so that's why I think it's so important to try to figure out exactly at what age lung disease starts, so that we can start to generate some evidence base to say, what, for instance, I don't know that this will be the outcome, but maybe it will be, starting at age, 30, 35, just like you get, your blood pressure checked, and maybe you get your cholesterol screened every couple of years, you should get your lung function screened. What I will say is, if there's anyone who's watching this or listening and you're thinking to yourself, I've had a little bit of a cough, or I am a little more short of breath, or actually it's harder for me to exercise and keep up with other people of my, same age, push your doctor to get spirometry, to get lung function testing on you, just to make sure, because we have a massive underutilization of lung function testing in this country.
Very important message. That's a great message, MeiLan. We have another question. I think this is a good question for you to answer now. It says, is your book easy to understand for the non-scientists among us? And can you tell us how it's structured?
Sure. Thank you for asking. So I tried really, really hard to make this book, to take stuff that's sort of scientific and complicated and to make it digestible. And I use like a ton of metaphors in the book to say, this is like this, like, so explaining the hair cells and lungs as being sort of like an escalator to carry out debris. So the book, I'm just going to open it up now to make sure I'm remembering it correctly. But, and I there's different parts about the book, and people may enjoy parts and want to skip over other parts. And I think that's fine. So the first chapter is just how lungs work. I spend so much time in the office trying to explain to people, like drawing it out. It's, the lung actually has two separate circulation systems, and just trying to explain that to patients, the difference between systemic hypertension and pulmonary hypertension can take, 10 minutes. So for me, I'm just excited, honestly, to have a tool that I can use to try to talk to my patients, in the office. So the first chapter is how the lungs work. The second chapter is all about lung defense. How do we protect ourselves? Are the lungs up against? And that's where I go into viruses and have a whole section on COVID and explain with pictures what COVID does to the lungs. Then I have a whole chapter on birth to death. How do you protect yourself? What are the factors in childhood, in adulthood that you have to be thinking about just in everyday life? Things like low VOC paints, kind of across the spectrum. What should you be thinking about to protect yourself? The next two chapters actually have to do with how we diagnose lung disease and a very brief overview of some of the most common lung diseases. So if you have friends, family members, or loved ones that have a chronic lung condition, and you're curious of what should I expect when I go to meet a pulmonologist, or how can I advise them, to be advocates for their own health, those two chapters are, I think, really helpful. And then, as I mentioned earlier, the last chapter is called The Fifth Vital Sign. And that's where I really talk about how it is where we are in this position today, where we don't measure lung health the way we should. It's not really at the forefront of thinking. It's not something that's as well funded as it should be. One of the things that I talk about in the book, and this is a huge thing that the American Lung Association is trying to solve, is there's a lot of stigma associated with some of our more common lung diseases. So lung cancer and COPD in particular have been associated with smoking. But there's a lot of people who have lung cancer and COPD who didn't smoke. And we also know there are a lot of other factors that play a role: environmental exposures, genetics, et cetera. And every disease that we treat, heart disease, everything, diabetes, has some genetic and some environmental component, and some are potentially under people's control and some are not. But, ultimately, it's just not helpful just to fund diseases or treat diseases or people and their issues as being important based on some perceived notion of how responsible they are for creating the condition that they're in. So I think it's really important we stop that rhetoric. We have to reframe and think about, just how do we move forward? But unfortunately, some of the patients have really, a lot of our patients with certain chronic lung diseases live in rural areas, and they may be socioeconomically disadvantaged, and they're the people least able to advocate for themselves. So the last chapter is really about how can we raise awareness? How do we help people advocate for themselves, which is a lot of what the American Lung Association's doing. How do we work with Congress to appropriate more funds? How do we work with pharmaceutical companies? There's some actually really cool models, funding models that are being developed on how to fund and research and develop new products with some of the breakthroughs, for instance, in cystic fibrosis. So that's sort of a long-winded answer, but that's sort of the book in a nutshell.
And that's great. And I think that last chapter kind of feeds into this other question that's come in. It's more of a lung association question. They want to know if the lung association advocates against harmful chemicals in the industry that pollute the air. And I'll start out with that answer with a little bit of a longer answer with the Lung Association does work by way of really three arms of our mission: educating, raising awareness, which is on our website, blogs, webinars. We do a lot of research support that has been talked about through the discussion tonight. And the third one we haven't mentioned as much, but advocating for clean air by way of looking at what the EPA is doing as far as ozone and the criteria pollutants. We testify at EPA meetings regularly to make sure that the law is being upheld. MeiLan mentioned that we've testified at the FDA to help make sure they're doing what they should be doing around e-cigarettes. And we advocate for equal access to care, making sure Medicaid does what it's supposed to do for those that are less advantaged. So it is an overall approach to lung health: educating, advocating, and doing research. And MeiLan's been very helpful in doing that for us. I don't know if you had any other comments around that, MeiLan, or not.
I just think it's a constant battle, that the protections that we have in place for clean air, to protect kids against tobacco, we either need better protections or the ones we have are constantly being attacked and eroded. And making sure that government is holding up their end of even stuff that has been approved. So, it unfortunately it does take a village and constant vigilance. But one of the things, while this is a fight that some of us have been fighting for a while, one of the things that I'm hoping to do with the book is to kind of bring this fight to the public and help people to understand their role in advocating for their own clean air, their own lung health, for their families, but also for their communities.
So before we open it up to more questions in the audience, is there anything we haven't covered so far from your book or from your career that you'd like to talk about tonight, MeiLan?
I honestly, I think we've covered most of it, but I think my biggest hope with this book is that that I think education is powerful. And I think that for too long, the lungs have just either been ignored or just kind of a black box. And unfortunately, even some physicians are uncomfortable with certain aspects of how the lungs work and interpreting breathing tests. And so my goal with this book was to kind of blow the lid off of making this mysterious. It's not mysterious. It's understandable. And if you can understand it, then you can advocate for yourself. You can advocate for your friends, for your family, for your kids. You can be an active part, in the conversation of families and your community, and the government. And I think it's too long been under the rug, shrouded in mystery. And so that honestly is really my hope with this book, is to arm individual citizens with knowledge, because that knowledge, I think, can be so powerful.
No, I agree. I read the book and I agree that it's very digestible by lay people. And a lot of what we do as physicians, and certainly as the Lung Association, it's all about the patients. And as you said, if we can empower the patient with information, have them have the right tools to ask the right questions when they're dealing with their healthcare providers, that goes a long way in helping ensure that they're going to get the proper care they need. So again, I thank you for writing the book in the manner that you did. I'm looking for other questions from the audience. I don't see anything right now. And we did cover quite a bit throughout this.
Yeah, I'm just trying to think about whether there might be any other interesting topics for our readers.
Touched a little bit on when we talked about research about clinical trials that we're doing, and that's one thing that we're always trying to promote is for patients. This is people who may have a lung disease already or a new diagnosis, but consider being part of a clinical trial, because that's really how knowledge, how we learn about interventions that are going to work or not work. And all clinical trials do carry some risk with them, but there's also some reward in being part of a clinical trial. And nobody better to answer that than MeiLan, as far as a researcher, to tell us about that experience.
Yeah, it's we wouldn't have the treatments that we have if it wasn't for research. I traditionally do lung studies, particularly in chronic lung diseases, as you mentioned, COPD, airways disease. But during the COVID pandemic, I even helped to lead an international COVID study. So this is kind of the work that we're all doing right now, just trying to figure out how to help patients with respiratory illnesses and move forward. But some of our kind of prior research is getting finally back engaged. But there's just so much important work going on right now. What I would say is, for people that are quote unquote healthy, or you think you don't necessarily have any respiratory issues, studies like the American Lung Association's lung health cohort are going to be incredible. And actually, I think it kind of fun. I'm too old. I don't qualify, but if I was younger, I would definitely consider signing myself up. Because we'll be doing breathing tests, and to be honest, I've only had my breathing test done once, and that was as a pulmonary fellow to understand how the test was done. But as well as a CT scan. But for patients with chronic lung diseases, in particular advanced diseases, there's participating in research studies are so important, because that's how we develop new treatments. I will say I've been somewhat frustrated by the pace of new developments for respiratory disease. One of the bizarre things is that when diseases develop slowly and progress slowly, as some of the respiratory diseases do, it actually makes them really difficult to study, because it takes years to alter the outcome that the FDA needs to see to approve it. And so we've really had some challenges getting new drugs approved for certain respiratory diseases. There are kind of a new class of medications that many pharmaceutical companies are looking at now, called biologics. And these are often either injections or infusions that are often antibodies to very specific proteins within the body that can target very, very specific inflammatory pathways. So we've started to see some new treatments, some new breakthroughs for things like asthma. We may see things for COPD. I think there are also some exciting developments on that front for things like lung cancer. We're starting to see the developments of new procedure-based therapies for lung diseases that I think are going to be really exciting. So, my hope is that perhaps a silver lining from the pandemic is that it will hopefully spur new research and new development of new treatments for patients. But it's definitely it is an exciting time, I think, from that perspective, to be in the respiratory field.
Well, before I turn things back to Candace, I'll just say that I think you can gain a lot of knowledge by reading MeiLan's book, Breathing Lessons, and also go to lung.org for the American Lung Association's a lot of information about what we do and information that will help you have lung health for the rest of your life, hopefully. So Candace, I'll turn it back to you, and thank you, MeiLan.
Thank you, Al.
Well, thank you both so much. This has been really great. I want to thank the audience as well. Thanks so much for your questions. If you're interested in purchasing a copy of Breathing Lessons, I encourage you to use the link in the chat. That's going to take you right over to Third Place Books. You can support a local store tonight. But thank you both so much again, and best to you, MeiLan, with the rest of your tour for this awesome book.
Thank you so much.